This brief will discuss the return of investment that the Veterans Health Administration can expect from a VISTA implementation. What makes return of investments important? Many organizations are trying to put a value on their IT investment so they can accurately justify funding. In the healthcare arena, this seems to be much more important due to the lack of buy-in by clinicians and hospitals. There needs to be a value associated with implementing IT in an environment which seems to work fluently without it. Another reason to compute the return of investment is because of the competition between vendors. It is important to understand what is the expected return for an organization before investing in an IT product. Vendors are constantly trying to outbid one another, and an estimated return of investment can help an organization to determine which vendor will give it the best service or implementation for the expense. Finally, accurate accounting leads ways to return of investments. By understanding an organization's return of investment from an IT perspective, an organization can better define its upcoming budgets to accommodate future IT investments. What is VHA and VISTA? According to an article released by the International Journal of Medical Informatics, the Veterans Affairs provides benefits to U.S. military veterans and their families. The Veterans Health Administration, a subsidiary of the VA, operates the nation's largest medical system. It employs approximately 180,000 healthcare professionals. These healthcare professionals are scattered across 163 hospitals, more than 800 community and facility-based clinics, 135 nursing homes, 206 readjustment counseling centers, and various other facilities to date. The VHA is also known as one of the nation's largest providers of graduate medical education and a major contributor to medical and scientific research. Dr. Termesi presents in his brief the VISTA, or the Veterans Health Information System and Technology Architecture, released a computerized patient record system known as CPRS that translates clinical practice guidelines into clinical activities. It is an integrated electronic health record application that provides a real-time decision support system for clinicians that provide reminders and alerts. CPRS facilitates documentations for performance measurement and improvement efforts. There are about 128 VISTA systems in use for the VHA. VISTA is known as a complete hospital information system that encompasses electronic health record, imaging, and barcode medication administration. In 2004, it was estimated that it would cost about $78 per enrollee to use VISTA. This was an average of about $3.6 million per hospital. The analysis method that is used to calculate the return of investment is as follows. The first step is to gather the objective data. In this study, information on the cost of IT, the use of IT, and the budget of the VHA was used for fiscal years 2006, 2007, and 2008. Second, you should verify expected associations. If returns can be attributed to IT investment, there must be an association among the cost of IT, use of IT, and that budget. The overall goal is to show the relationships with regards to IT costs. Correlations will be used to illustrate this for this study. The closer the number is to 1, the closer the relationship between the two variables is observed. Next is the verification of causality. This is a test of whether the increased budget has led to more IT use or vice versa. Finally is the calculation of the return of investment. If the IT investment can be assumed as a reason for growth in budget, then it is necessary to calculate a rate of return. For the VHA, the previous methodology was used. For step 1, data was gathered for years 2006, 2007, and 2008. Those variables that were chosen in these studies include the IT budget, the IT usage, and the cost of IT as illustrated. For step 2, correlation was used to verify the expected associations between the variables. From the data, it can be seen that there is a strong association between the IT budget and IT usage, as well as the cost of IT and IT usage. Step 3 allows for the causality test. It is shown that the IT budget has the closest causal relationship between the variables. However, since the equations do not equal 0, there is no need to calculate the return of investment for the VHA assessment. Overall, it can be concluded that the VHA's IT budget has the largest impact on the use of the VISTA system. However, using the appropriate data was problematic for accurate results in this study. From a learning perspective, this was an excellent opportunity to experiment with the return of investment methodology. This concludes this presentation.